We're back now with Kristina Cronin, a nurse practitioner with Cone Health Primary Care. She's talking about maintaining your blood pressure. So what's considered a normal blood pressure? A lot of us don't even know that.
A normal blood pressure is 120 over 80.
Okay, do you want numbers that are higher or lower than that?
We want numbers that are either right at 120 over 80 or a little bit lower.
What's the difference between the 120 and the 80? What do those
So
numbers mean?
the 120 is when your heart is contracting, so when it's pumping the blood, and then the 80 is when your heart is resting. And that's when it allows time for the blood to flow up in the heart.
So at what point over those numbers do you need to start worrying?
So we like to kind of say 140 over 90. Yeah, 140 over 90. So we can break it down into stage 1 and stage 2 hypertension. So stage 1 is 130 to 139 over 80 to 89, and stage 2 is 140 over 90. So I tell my patients anything 140 over 90 or higher,
Does
definitely
it
come in and checked out.
Are those numbers the same for everyone, or does it matter? Like if you go to the gym all the time, is your numbers, are they going to be different?
So if you are more active, your numbers will most likely be a lot better. For older patients, we give a little more leniency. So that's why we say 140 over 90, according to the American Heart Association.
So 140 over 90, you need to start finding out about treatment. But is there a number that's so concerning you'd maybe go to the emergency room or call 911?
Correct. So anything 140 over 90 with symptoms. So symptoms would be chest pain, severe headache, shortness of breath, anything that is acutely happening in that moment. Now, if you're having readings 140 over 90 with no symptoms, then that's when we would say continue to watch it, come into the office, get checked out, let us take a look. At either home readings or in office readings where we can repeat it and watch it in a controlled setting. Anything over, I would say, one 180 over 120 is when we need you to go to the hospital, regardless if you're having symptoms or not. That number does seem very high. So I would say anything 160 over 100.
We talked about lifestyle changes earlier, but is there medication too to help people with their blood pressure?
There is medication, and depending on the patient, it's all kind of based on age, their kidney function. We like to go kind of based on their ethnicity. Some patients do better with certain types of medications over another. So I like to definitely go over that with all of my patients and explain why we're choosing a certain medication over a different one.
A lot of people just don't want to have to take a medication if they don't need to. But what kind of
Yes.
difference can it actually make for someone with high blood pressure?
It can make an impact on your life, honestly. So you're going to decrease that risk of heart attack, decrease that risk of stroke. Um, your heart, if it's, pumping blood forcefully, it's causing it to work harder, then you are more at risk for heart failure. So getting those numbers down is essential. It's important, even though you may not have symptoms at all.
We've all heard that stress can make your blood pressure go up. How much truth is there to that?
That is very true. So we do recommend reducing your stress levels, trying to meditate, and also exercise is a great way to manage stress. Also, so we do recommend 150 minutes per week of moderate intensity physical activity, and that can even help lower blood pressure.
Is there a quick trick that you have to like help calm us down to lower your blood pressure?
I like to use, if you're feeling, stressed in the moment, You can use the box breathing, so 4-4-4 breathing. You inhale for 4 seconds, pause, hold it for 4 seconds, and then let it out for 4 seconds.
I just tried it. It's so peaceful. That definitely makes a difference.
It's a great
Hey,
exercise that anyone can do anytime.
what else do you want to tell people? Someone who's on the fence about, I don't know if I should go get checked. What would you tell them?
I would tell them it's important for your health. Even though, you might be a little bit nervous, you might be hesitant, um, I would still go get your blood pressure checked out. And even, we're not here to shove pills down your throat. We're here to work with you and make a lifestyle change and truly impact your life. And as we can see with Mike's story, weight loss is very impactful for decreasing, high blood pressure and the risks that come with that.
Well, thank you so much for being here. We appreciate this life-saving information.